lung should be fully expanded, but because of all this black, which is a fluid, it sort of caused it to collapse. And you have it like flapping away in the wind there. And then that's the fluid that we can drain. So it's a decent sized pocket. Should be good. You know, I guess what this is? Squeezing away.
My heart?
Yeah. So it's your heart through your lungs, basically. Because this ultrasound beam is going straight through the lungs. And ultrasound likes fluid, so because you have this nice pocket of fluid, so it brings out everything underneath it.
Yeah, it's pretty tender there.
Yeah, you've got a safe enough pocket there to get us some fluid. Alright, let me get a wipe for you.
This side feels a little sensitive.
Where I'm pressing?
Yeah, kind of from the last few days.
Okay. Is it tender where I'm pressing right now?
Not this second, no. Something I did.
Yeah, sore.
Yeah.
So on ultrasound, black is fluid,
Okay.
and white is everything else. So that's, you see that little thing that's like flapping away in the wind there?
Yeah.
Let me try to turn up the... So basically what we're going to be looking to do is called a thoracentesis. It's just a fancy way of saying draining from your chest. So what we do is sit you up just like you were sitting. Again, we have an ultrasound downstairs. We'll look for that safe pocket. We want to go in between the ribs. And needle goes in first, numbs your skin up really nicely, and then goes in a little bit deeper, numbs the tissue underneath it. We get into the space, and then we put a catheter in there and take the needle out and drain as much fluid as we can get, and then we send the fluid for testing, okay?
Okay.
So because you've been having fevers and that sort of thing, we want to make sure that that's not infected.
Right.
So those tests, some of them come back within the same day, but a lot of them come back the next day or two, especially the cultures and that sort of thing.
Okay.
So the benefits for you, I don't know, have you been having trouble breathing?
Just a little more weakness on that side.
Yeah. So you might feel like once we get some of that fluid off, your breathing is more normal, because you saw that sort of lung that was like flapping away. So that should expand back to a normal lung once we get rid of the fluid.
Okay.
And then another benefit would be knowing why you have this fluid and trying to tie it to the infection if it's related.
Right.
So anytime we poke you, there's risks, obviously. So the most significant risk for you would be bleeding. So that's why we asked them to give you platelets, because your counts were a little low today.
Yeah.
Anytime we go into a space, there's potential that we introduce infection. Again, we're using sterile technique. We're covering you up, cleaning you up before we do it. Sometimes we can introduce air into the space. So instead of fluid, air goes in there. We're very careful to not do that. And then in those cases, instead of just going in and out, sometimes you have to leave a drain in there to get rid of the air and that sort of thing. But I don't anticipate that we will run into that. It's a risk. It's a small risk. Okay.
Okay.
Usually the procedure start to finish takes about 30 or so minutes, just setting you up and numbing you up and doing all that stuff. But the actual drain doesn't take very long.
Okay.
It's normal when we're doing it to feel like you're coughing, to feel like we're causing some irritation. And while the lung opens up, it takes a minute to sort of equilibrate again.
Right.
So the maximal benefit is usually a few hours after the procedure. Okay.
Okay.
Questions, concerns? You want me to go through anything again?
No.
Do you guys
Makes
have
sense. Any questions?